I'm Richard Bonney from the University of Virginia. I'm chair of the planning committee for the workshop on health, safety, and well-being of young adults. I'd like to welcome everyone and thank you all for joining us for, I think, what it certainly is going to be a very intense 2 days. I think it'll also be very informative and interesting as well. As you know, the main purpose of this workshop is to shine a spotlight on these health, safety, and well-being issues relating to young adults. Have been underattended, and obviously we're in, not only are they in transition, but I think our society in many ways is in transition, and it's very exciting to explore these issues. I'd like to also thank the sponsor of the workshop, the Maternal and Child Health Bureau of the Health Resources Services Administration. And we're also pleased that Trina Anglin and others have, from HRSA have joined us today. Before I introduce Dr. Anglin for some orienting remarks, I'd like to say a few words about the background and design of the workshop. So this workshop is designed to provide a sense of the landscape, what research now exists, what the gaps and needs are, and to help identify some of the important issues that might deserve more intensive study. The way I've been thinking about this phase of the work is that we are looking at this obviously broad set of questions from a variety of different perspectives, not only, of course, in terms of disciplines, but from just about every angle we could think about as you look at the design of the workshop, and create essentially a mosaic from this work. Not worrying so much now about integration, although we are going to try to have some cross-cutting themes, and we've been thinking about those. But by having this intensive look at the time of this workshop, we can then sit back and reflect on what we have learned about what we know and what we don't know to bring a more integrated perspective to the subject. So with this in mind, for the workshop, we've intentionally developed a very packed agenda to assure that we do try to cover a large portion, although probably not all, of the key topics. We have asked each speaker to provide up to 15 minutes of remarks to allow ample time for questions and discussion. The proceedings will eventually be assembled in a workshop summary, and we will be having in mind the importance of trying to get elicit discussion so that we can make sure that all the observations that are relevant to the summary have been recorded in the workshop itself. So this is meant to be the first phase of a three-phase effort. The second phase would be a full Academy study, a consensus study, jointly here between the IOM and the NRC, that comprehensively reviews the evidence and makes recommendations for improving the health, safety, and well-being of young adults through policies, new research and systems development, and changes to existing service delivery models and policy structures. We hope that the workshop presentations and the discussion, as I mentioned earlier, will serve as the foundation for that study. The third phase will involve extensive communication activities. As part of that effort, as I've indicated, we'll have a summary of the workshop which will highlight the key themes and ideas from the presentations and discussions that we have over these 2 days. The publication will also include an updated version of 2 background papers that you have in the materials before you. With all of that in mind, we are recording the workshop discussions and also ask you to introduce yourselves if you have a comment or question and go to the microphone. I'd also like to take the occasion to welcome our webcast audience and welcome everyone who is joining us by webcast today. I understand we have quite a number of people that had registered in advance, and I gather there are probably people that are on the webcast even beyond those that have registered. It's wonderful to have so many people join from across the country and even in international settings. The people who are viewing this on webcast should submit comments and questions throughout the 2 days. Although obviously we're not going to have time to get to all of them, the IOM staff will be capturing them as part of the record of the meeting, and they will also certainly inform the ongoing work of the project. Finally, I'd also like to welcome members of the young adult generation, at least for the purposes of the committee. We're not quite sure what age span that actually refers to, but we have a general idea, and we have invited a number of people from that demographic group to join us. And we'll have a panel at the end of the day in which we will hear young adults' reactions to the presentations and discussions, what seemed important to them, what was missing, and any other impressions that you might have. I encourage also everyone, including our young adult panelists, to ask questions and comments during the full discussion throughout the 2 days. All right, so with that kind of laying the groundwork here for what we're about to get started on, I do want to introduce Trina Anglin to provide introductory remarks. She's the chief of the Adolescent Health Branch of HRSA's Maternal and Child Health Bureau, and in this role, she oversees efforts to provide national leadership in promoting health development, safety, and social and emotional well-being of school-age children, adolescents, and young adults in the United States. Her bio sketch is in your meeting books, but I actually looked at it and it describes what she's doing at HRSA. I might point out that she came to HRSA with a very broad background in this area, practicing in adolescent medicine and conducting research in the area in highly in both clinical and system settings. So she had tremendous experience that she then brought to the position at HRSA, and I think we're very fortunate that she did, and that she is going to welcome you to the workshop and introduce it for us. Please, Trina.